Good afternoon. My name is Kevin Latinis. I'm making this video to send out to all my patients, to my family, and all my friends in regards to my view of what you can do at this point regarding the coronavirus. I think the current state of affairs is alarming, it's scary, and I want the message to be that we will get through this together, and it's important that we all take action at this point to adapt to our changing environment. I appreciate and I want to thank several people, particularly my family, my friends, and all my clinical staff who have endured my concern over this over the last few weeks. And I am sure they will have more to endure as we go through this together. The purpose of this is to review several things. I'm going to tell you what I think you need to know regarding the science. I'm going to talk about social distancing because that is very important right now. I'm going to talk about what you can do to save lives around you. And then I'm going to talk about, in the end, what we can all do as a community to support each other from a health standpoint, from a social standpoint, and an economic standpoint as this outbreak and pandemic progresses over the next few months. The first thing that many of you already know is that this is a very serious health threat. The things you need to understand about infectious diseases are two things. First, you need to understand the infectious nature and the transmission of a particular infection. How contagious is this? The second thing you need to understand is once you have an infection, how severe is it and what are the health consequences? Basically, how virulent is this virus? Speaking to the first aspect, I think we are all becoming increasingly aware that this virus, the coronavirus, is extremely contagious. And I will make a couple messages to not make the mistake of being naive about this. One, this virus spreads by respiratory droplets. Those who are infected have very high virus counts in their lungs and in their oral pharynx, and when they cough, sneeze, or leave any sort of droplet on any surface, the virus can spread to you. We are talking about a 6-foot safe distance between other human beings to avoid this. But be aware that when a cough droplet from somebody that's infected lands on a surface, at least the best science at this point suggests that that virus may live there for at least a few hours and possibly many days. Okay? The other thing I want to speak to is that the virus not only can live on a surface for several days, but people can actually be sick with the virus before they realize they are physically ill, meaning they are infected, potentially spreading this as silent spreaders for up to several days before this occurs. This is a little alarming, and this has led to the extreme contagious nature of this virus, and there's nothing you can do about this other than just be aware of it at this time. The other point I'm going to make is that I am speaking from a reference of scientific intuition, and I want to applaud our governments and our local institutions at all levels for doing the right things every moment of every day. We have acted very, very strongly together to improve our condition. I will make the comment that we need to do more, and the virus is expanding on this curve. We were expanding on this curve, and we have ramped that up significantly, but I'd love to see our response outpace this virus response in the very near future. Because I'm speaking from scientific intuition, I may say things that aren't 100% factual, not because I'm trying to propagate errors. I'm just telling you what I think. And at this point, the facts are here, and if we wait for the facts to take action, then we're going to be weeks behind in our actions, and this could become worse. So I'm trying to send a message that we need to act ahead of where we are. With that said, let's go back to the virus. Viruses are highly contagious, and this one's highly virulent. The data that we have out of China is the best epidemiologic data we have. We will get more data over the next few months, But what we need to do now is understand how virulent this disease is. The good news about the virulence of this data is the majority of you that are going to get sick are not going to get that sick. In fact, some important points that I want to make are that there have been no reported deaths in children under 9. That is great news. I think that is something that we should be thankful for and continue to hope that holds out that way. The best data we have to discuss how serious an infection is once you get it is mortality data. And this is how many people died who had confirmed infections in China. Up to age 9, no deaths. From age 9 to about age 50, there is a slight linear increase or a flat line that approximates about 0.1% mortality. That's a rough estimate. From 50 to about 70, it's an increasing linear expansion. But what's really the health problem is that in patients aged 70 and older, the mortality rates get upwards of around 20 or even 25%. And it is this population that is highly susceptible to severe consequences and needs access to our healthcare system. And my message to everybody is, I have patients in this age group, I have family members in this age group. What we need to do is not only be concerned about what we're going to do when we're going to get sick, but how are we going to protect our friends and family who are in this age group. And I think we can make changes today that are going to impact this. And you can make a change today to impact this. The next concept I want to talk about is something a lot of you all are quite aware of, and this is called flattening the curve. If this is redundant to you, then fast forward, but I want you to hear this. What's about to happen in our country is what happened in China and is currently happening in Italy, in Iran, and other countries. When this infection emerged in late November and early December in China, nobody knew what it was. And rapidly through December, the number of cases and exposures spread. There became information that was available that this was a serious disease, but by that time, the number of patients infected outpaced the healthcare resources. The red line on this graph represents what our capacity is as a nation, locally, and all our communities to handle the surge of sick people that we're going to see over the next 2 to 8 weeks. What happened in China, and the whole reason there's a high mortality and that these people suffered quite severely, is that when patients got sick, they needed a lot of support. They need oxygen, and some people need ventilator support. The problem with our healthcare system is we do not have a substantial surge capacity to deal with this kind of curve. What we can do and what you can do is you can spread this out and flatten the curve. And so every single human in our country can make an impact on this, and you can exponentially impact this by telling the people you know and love about this. What we can do in this is slow our rate of transmission, ideally, and spread this out over a longer period of time. The thing I want you to realize is this doesn't mean you're not going to get this virus. I still think upwards of 80% and maybe higher people will be exposed to this virus and get sick. I think the epidemiology will show that in retrospect. What we'd like to do is to have the 80% of us that are going to get sick not get sick over the next 2 months, but maybe get sick over the next 6 months. Because that way, when the 70 and 80-year-olds get sick with this, we have ICU beds available and we have ventilators available to keep them alive. People just need a short amount of care when they have an acute inflammatory response in their lungs, and we just need these desperate resources. So again, I'm not telling you that you're not going to get sick and that you're not going to not be exposed to this virus. What I'm telling you is what you do today is going to impact whether this spreads rapidly in our community or slowly in our community. What I want to do is show a couple videos of exactly what this means. There is the concept out there called social distancing, and this is really critical. And what I hear people saying is that we get it, we get it, we get it. Let's do this. And I applaud everybody, and I'm very happy people are taking this seriously. And my message is, do more. Do it better, because we are not doing it enough. What we're going to do now is talk about the models of different infections. The first model you're going to see is what happened in China in Wuhan province. With uncontrolled spread of this virus, as the blue dots convert to orange, patients are getting infected, and then you'll see they turn pink as they get over this infection. You'll notice the curve at the top represents the bell-shaped curve that is a rapid infection model. The next model represents what we can do if we completely contain a section of patients that are infected. Early on, this is great, but I think what you're seeing here is that there's going to be some breach of containment, and then it's going to go out to the community. This is likely what's happened in more of the restrictive places such as Singapore and Hong Kong and South Korea. Again, I'll point out that everybody's going to get this virus. Everybody's going to get infected, but the curve is getting stretched out over a much longer, slower period of time so that our healthcare system can adapt. The next model is going to show you what happens if we restrict movement of 1 in every 4 people to stand still. You're going to see that the 1 in 4 people that are moving will still spread this to everybody. It will eventually infect everybody. And again, you guys are all going to get sick. The key to this is the curve at the top is very flat to the point that our healthcare system can better sustain this. Finally, we have a model where only 1 in 8 people move. And in that situation, the curve is extremely flat. This is really what we want to start doing today. By not going to church, by not going to the movies, by not going out to dinner, by not doing anything, not going to work if you can't help it, then we are going to flatten this curve out substantially. And it's going to help support our healthcare system and our first responders to be able to keep as many people alive. By doing this, we can significantly impact the mortality rates so that the patients 70 and 80 and older will no longer have a mortality of 20%, but we can hope that we can lower this down substantially. So I think Anthony Fauci, who you've seen on the national TV next to Trump, when he said hunker down, that's what I want you to do. I want you to take this seriously. I want you to stay at home. For those patients of mine that are worried about your medical condition and your medications, I have developed specific guidelines on what I believe is the appropriate thing to do at this time in regards to your immune-based medicines and whether you should come to clinics or not. I'm expecting that starting next week, I am not going to see you face-to-face for some time. I will figure out a way that I will be able to stay in touch with you, whether it's through phone calls or video communication. And if you need to come in for a treatment that I think the benefit outweighs the risk, then we will do that. I want you to get the care you need. Life is going to go on, and we need to be able to take care of that. But what we really need to focus on right now and today is social distancing. And what you can do to help this message is you can tell everybody you know that this social distancing is really important, and it needs to start today. People have finished going to church. It's Sunday. I'm happy we're all home with our families. Tomorrow, I want you to think about what you can do to stay home and then what you can plan to do to limit your exposure to other people. And this is going to be a boring, long process, and we're going to get through this together. The other aspect of this is socially this is going to put a lot of stress on us. Our kids are not going to be in school. They're going to need things to do. Think of creative ways that you can support the healthcare industry. Can some of you babysit healthcare workers' kids? What can you do to support your local restaurants? Can they deliver food for you instead of you going out? All of you are smart people, and you can figure out what you can do to limit the spread. So this is just not me sending the message. This is you figuring out what you can do to lessen the severity of what's about to happen. Again, I hope that this is way less severe than we're anticipating, but when it does become severe, we're going to be here to take care of you. And over the next days, we'll figure out socially and economically how to adjust and what we're going to do. But this is a great time to help each other out and be planning for the next phase of things. Thank you all, and be safe. I want to make a few comments about what you should do if and when you get sick. First of all, you guys are doing a great job of washing your hands and wiping down the carts. Keep doing that. Try not to touch your face. Keep doing that. Work on social distancing. You can be better at that. But what do you do when you get sick? Because what I just told you is we're all going to get sick, and we need to be able to handle that. The majority of you are going to feel crummy for a few days, maybe 3 days, maybe a week. You may have high fevers. You're likely to have a cough. You may have some GI symptoms. The best thing you can do is to hydrate as much as possible. My message is always to drink enough fluids that your urine is clear, and continue to push that. If you struggle with that or you're having a hard time staying hydrated, then contact your doctor and find advice for what to do. The key about this whole coronavirus sickness is, when do you go to the hospital? The wonderful thing that happened today is that we had a massive expansion in testing capabilities. In the next few days, if you have a fever or cough, you're likely going to be able to go to a drive-through clinic to get tested. You will get tested likely for the flu and other common respiratory viruses, as well as the coronavirus. And then if you are not in respiratory distress, you will likely be sent home to take care of yourself or to take care of your family. Again, hydrate. If you have fevers and are uncomfortable, Tylenol up to 3,000 milligrams a day is appropriate. Non-steroidal anti-inflammatories, including over-the-counter ibuprofen and naproxen, brand names Aleve and Advil, can be used as well to supplement this. Those will help keep the fever down and keep you more comfortable. They'll also limit your fluid loss and your getting dehydrated. The most critical thing to know is, when do you need to be in an emergency healthcare setting? You need to be in an emergency healthcare setting when you're having trouble breathing. This virus can cause an extreme inflammatory response in your lungs to the point that you will build up a lot of fluid in your lungs. It will be difficult for oxygen to get in and carbon dioxide to get out, and that will cause you to breathe faster, and it'll cause your heart rate to become faster. It may feel like you're panicking. These are symptoms. If you have access to a finger pulse oximeter, which you can order on Amazon, or some of the local pharmacies are still carrying these, then get one. These are devices that can measure your oxygenation very simple. My general rule is that if it gets below 90% and stays there, then you need to get to the emergency healthcare setting. Okay? This isn't you need to call your doctor. This is not going to urgent care. This is going to the local emergency room so you can get tested, triaged, and treated. Okay? I want you all to stay safe and be careful. Stay hydrated and use your anti-inflammatories and your Tylenol. And contact me if you have further questions or concerns. And please pass this on to as many people as you know.